Started the forum last year precisely because we thought African leaders come to Addis and they talk about a lot of public sector events, and the private sector does not know what is happening, and the private sector doesn't really pay attention to Addis during this time of the year. 2 weeks before that, we have the World Economic Forum, and the private sector does pay attention. So we thought maybe we should do something in Africa where the private sector begins to pay attention to Addis and what is happening, and that our leaders look at the private sector and watch to see also that there is a space in Addis, on the continent, in our union, for the private sector. But we know, as Ike has said, that the public sector cannot fund all of the healthcare needs of our continent. But we also know that the private sector has experience and has been funding healthcare for a long time in many countries. We know that a healthy Africa is a productive Africa. We know that a healthy Africa is a prosperous Africa. So we decided, as we decide to integrate, let's talk about health. Let's talk about health funding, and let's talk about how we can bring the public and the private sector together to ensure that Africa's healthcare is funded, Africa's youth is healthy, and Africa's business is prosperous. Today on the continent, we import $17.3 billion worth of drugs from outside the continent. $17.3 billion worth of drugs will create about 16 million jobs on our continent if we were to produce them on the continent. That is the purpose of this forum. It is to say we should no longer export our jobs. We can bring those jobs back. We can rid ourselves of malaria if we decided that we could produce affordable drugs on the continent. It is true, health is a public good, health is a social good, but you can do a social good and do good business.
Investing in health sector is rewarding and is indeed part of corporate social responsibility. In my view, public-private partnership offer an easy entry point for sustainable health financing. If leave no one behind is a mantra for achieving the SDGs, then achieving universal health coverage is vital to ensure that Africa is not left behind. We must capitalize on public-private partnership modalities in healthcare and recognize that they rely heavily on political will and require a great deal of interdependence between the government and the private operators.
This forum is vital in our collective pursuit of improved universal health care. In the case of my country, Botswana, I wish to inform you that we have made some strides in embracing private sector partnership through the adoption of pluralistic health service delivery. In this regard, my government has made a strategic and deliberate policy decision to promote private sector participation in the health sector. We have established the Sectoral Health High-Level Consultative Council, commonly known by the acronym HLCC, co-chaired by the President, myself, and the President of the private sector. Among the key achievements my country has made in the health sector as a result of the public-private sector collaboration are: 1, provision of air ambulance services through engaging local companies for airlifting patients.
Without making health a right for every single citizen, it will not be possible for us to talk about achieving our dreams of 2030. Leadership, governance is critical. You don't transform the space for bringing private sector, for making sure that what we want to really see happening without changing on policy. This is the first report in our continent on health where we are trying to address these issues, to analyze, of course, to put some emphasis on areas of challenges and, of course, opportunities. But I think what is great in this report is that is bringing a light on how innovation can bring an added value to what we are doing in this continent. And thanks for producing this report.
Big round of applause. Yes, Dr. Development of a specialized private sector at the regional level, as well as digital health technologies, could offer solutions. Private sector joint ventures, if all these targets are not achieved, then all the progress and performance made by our countries would have meant nothing. Public-private dialogue must emphasize on health as a priority sector where large investment facilities and incentives could be offered to attract skilled human resources and modern structures.
Healthcare in Africa is constrained by very, very limited public spending, limited donor support, and indeed you'll be surprised to hear that it is out of the pockets of Africans, who, as you know, are not the wealthiest citizens of the world, that 36% of healthcare expenditure in Africa comes. Our populations are growing. Our disease profile is changing. We have no choice but to think of new and alternative ways of financing this gap. And I think we have no choice but to turn to the private sector to complement government funding.
1, 2, 3, 4, 5.
The public-private partnerships in health have catalyzed progress towards attainment of universal health coverage in Kenya. With a double burden of communicable and uncommunicable diseases, it is clear to us in Kenya that we need to mobilize private sector resources to support the efforts that we are making.
Governments are spending less, out-of-pocket expenditures is high, the density of skilled workers is very low, disease burdens are very high, and the governments don't have much fiscal space to spend on health. So in a sense, in kind of a double, triple, quadruple scepter whammy, I think, from all directions, if these countries are pressed from all directions.
Almost 2 years ago now, one of my ex-teammates in the national team died of heart attack, Sheikh Tiote, and because he didn't do the medical. So this is really important to me. I built a clinic in Abidjan, and the goal was to give access to healthcare to everyone. Participer à ce genre de forum, pour moi c'est très important pour rencontrer des personnes qui vont m'accompagner sur ce genre de projet et surtout développer la fondation pour pouvoir avoir un impact plus important.
My objective and wish for this forum and hereafter is that we leverage the full power of public-private partnerships to ensure that we can help shape and drive a health-centric agenda for Africa's accelerated development.